Hi, this is Dr. Eric Thomas, once more from Nutmeg Dermatology, trying to help you with questions you've sent in that I know you have about your skin. We're going to talk today about a cosmetic procedure. I prefer doing the surgery and taking out skin cancers, but this is probably the most common cosmetic procedure done in the United States. I'm talking, of course, about relaxing frown lines, relaxing, well, we've added some terminology. We now call these lines the 11sies because they look a little bit like two lines parallel to one another, like the number 11. We're going to talk, of course, about a poison. Oh, that might surprise you. What doctor starts out by saying they use a poison? Oh, look, botulinum toxin is indeed a poison, but many medicines can be used very carefully and there's no danger. Also, there are no living bacteria in Botox. So the original brand name was Botox. We often use a small b to indicate other botulinum toxins. We also use one called Dysport, and there's one called Jeuveau, or the Nutox, which is said to be more purified. In any event, these are very good. They have good news, and the good news is also the bad news. The good news is they're reversible. Hey, if something isn't quite right, it's not going to last forever, unlike certain things. The bad news is, hey, it's reversible. It doesn't last forever. And the material is fairly expensive, so you could wind up spending a fair bit of money. But it works. That's the important thing. And I've used it in a lot of people who are doing it not just for their own interest, just to feel better about themselves. Not that there's anything wrong with that. But I've also used it in salespeople who are, it's important that they look good. I can think of one person who looked like he was frowning all the time. And if you went up to him, you probably blinked quickly, and you didn't start out with the best way of interacting with this fellow. Another person, a woman, was given a golden handshake by the state of Connecticut, but was able to go back as a consultant in the department where she previously worked. And she's told me, I assume it's true, that among all of the people who retired with her, she was the one who kept being called back. She thought it was because, fairly or unfairly, the younger people who did the hiring saw her as more of their age. So there are a lot of reasons for relaxing the frown lines on your face. So how do we do it? Well, we use a very fine needle. It's finer than the one we use for injecting lidocaine. Again, if you're knowledgeable, we can use a 31, 32 gauge needle. It's very small, thinner than a pin just about. We mark the area so that we have things scientifically done, although sometimes that's not necessary. And we inject the muscle relaxant close to or into the muscle itself. These needles are so small that usually there's no bruising, although it can occur. It does take 3 to 4 days, 5 days perhaps, for the relaxation to occur, so you don't see the results the same day. But it works pretty well. How long does it last? You know, it depends. The newer ones claim to last a month or two longer. We try not to promise more than 4 to 6 months, plus or minus. Some people go to 9 months. It depends on how quickly they metabolize it. It depends on how much they need it. That fellow who is a salesman I mentioned had muscles that were so strong, I think he could have lifted 10-pound weights with his eyebrow. But in any event, it does work. Also, it is said, and I believe it's true, that the muscles themselves are not permanently weakened. All right. However, I frequently see, if we do it 3 or 4 times over the course of a few years, that the results seem to last longer. personally, I believe it's because people learn to use their muscles of facial expression differently. If you really can't go like that, then you're less likely to frown. I believe there was an episode of a sitcom, maybe you've seen it, where one of the younger brother goes to complain to his wife's dermatologist about the cost of some procedure. Of course, he, being a pushover, is quickly sold on some Botox. This was many years ago. Cut to the next scene, the older brother looks at the younger brother, thinking something might have happened, says to him, so-and-so, I won't use names, I don't know what the copyright is on these things, so-and-so frown. Younger brother says, well, I could if I choose to, but I don't, because he'd had the Botox. Anyway, I'm sure that those actors, that screenwriter, took that from real life. So Botox can be very helpful. When people come in, we ask them what they see, but then we also step back a bit and give them an evaluation of what we see. And it depends. Some people just don't need Botox. They certainly don't always understand it, because you have to, again, think of the anatomy. You have to think of the depth. What we're dealing with botulinum toxin, Botox, Dysport, Jeuveau, is relaxation of muscles. And that is a bit deeper. It's below where we put in, for example, fillers. Usually, there are exceptions. We'll talk about fillers as a separate issue, but I hope that this was helpful. This is Eric Thomas, wishing you good health.